Welcome to the Ultimate Dental Podcast, the place where you can learn how to create a dental practice and a business life that you love. Listen in with Dr. David Moffet as he interviews successful entrepreneurs and successful business people and successful dentists as they share their business successes, their stories, and their breakthrough ideas, sharing pearls of wisdom that you can take back to your practice and implement immediately so that you can have that great practice with more patients, higher profits, and less stress. This is the podcast where great dental practices meet with successful business processes. Thanks for tuning in to the Ultimate Dental Podcast, the podcast where thought leaders, industry experts, and thriving practice owners reveal their very best tips, tools, and strategies that will help you grow your dental practice faster. Now, here's your host, Dr. David Moffet.
Hi everybody, and welcome to today's episode of the Ultimate Dental Podcast. I'm your host, Dr. David Moffet. It is it's just gone midday here in Australia, in Burrowang in Australia, 2 hours outside of Sydney, and midday Monday. But my guest, Dr. Julia Jackson, is in Virginia in the United States, where it has just gone now 8 o'clock on Sunday night. Julia, nice to have you on the podcast. Welcome.
Thank you, David. It's a pleasure to be here.
Now, we've been chatting a little beforehand, and we also spoke last month when we met. We met through LinkedIn, and
Yes.
you've got a very interesting story, quite the achiever in dentistry.
Thank you.
Seem to have done a lot for somebody so young, and you're doing a lot for the profession as well. So let's get stuck straight into your history in terms of how you, where you did did you say a psychology degree first,
Yes.
Bachelor of Psychology, before you became a dentist?
Yes, I went to Wesleyan University in Middletown, Connecticut, and I was a psychology major, and I took the pre-med prerequisites. The idea was that I wanted to become a doctor, but I didn't know what kind, and I didn't know what were the necessary steps. So when they told us you at least have to take some of your core sciences, that was reasonable. But I didn't want to major in biology or chemistry. So psychology was a soft science, and I like to see and think about how people think, and it's come in handy in dental school and in dentistry in general. Mm-hmm.
I was going to say that I've always found whenever I've spoken with somebody with a psychology degree that I feel like they're not listening to what I'm saying; they're analysing what I'm saying. So I might be a little bit guarded here in this interview, but
No. Don't be
after the
guarded.
psychology degree, you then went to Temple University for your dental
Yes.
degree.
Yes. Temple is in the city of brotherly love, Philadelphia. And so at that point, I had graduated from undergrad and it was time to come home. I didn't exactly know which dental school. I was actually at a crossroads because just immediately finishing undergrad with a psychology degree, the idea was that I was going to go in and get a master's degree in psychology. And I actually had a set up that I was going to be doing an internship at a mental ward in Connecticut. Meanwhile, I was also trying to figure out, well, is that exactly the right path? I do want to work with my hands. I want to fix things. I want to be creative. I don't know if I'm going to do that in this psychology master's degree program. So I had applied for the DAT, the dental admission testing, and I did pretty well. And so when I submitted my DAT scores to different dental schools to find out that I'd be picked to a dental school that was home, which is Philadelphia, I said, well, I think it's meant to be. I've done my part here in Connecticut. Let's get back home. And Temple Dental was a very good start.
So you went to Temple Dental, you graduated with a, 'dental degree. What was the next step after that?
Next step after that was at that point, I had really narrowed my focus and was determined to become an oral and maxillofacial surgeon. After the 4 years of the dental program, very rigorous. I really like to extract teeth. They call me Dr. Extraction Jackson because I like to take teeth out. and and then it kind of morphed into, well, if you're going to take the teeth out, you should know how to replace them. And it seemed to me that oral and maxillofacial surgery would be the path that would satisfy all of my interests in surgery. So at that point, I was going to get into oral surgery program, and you have options. You can either do a 4-year program, you could do an internship, or you could do a 6-year program. And 6 years just seemed so long. I eventually ended up taking 6 years to become an oral surgeon, but at the time I didn't know that. And I said, how is this going to work out? So I did a 1-year internship in Brooklyn, New York. And then I stayed and did a 2nd-year oral surgery internship. And then I got into oral surgery in Washington, D.C. So it worked out. All the pieces started to fit together. And I really enjoyed all of my training.
So Washington, D.C. for your oral surgery degree, how long did that take?
4 years. 4 years, yes. But you see, the thing is, David, honestly, when you're in the middle of things and, the seniors are demanding, the attendings are chastising, the patients are just as brutal, and you're trying to figure out, well, is this the right thing to do? And how can I problem solve this mandible fracture and get the pieces to fit together? It didn't matter how long it took. I could have been in residency for 8 years or maybe 9. I would have been like, I can't take anymore. But the 6 years, they just ran consecutively. And each day you're learning new things and growing and being strong. So I loved every second, David. And there was a point where I had a little bit of pay. So I didn't have as many bills as I could have, because my internship was the housing was available through the program. So I got a little check and a little housing, and I lived on like the 12th floor. So I'd take the elevator down to the 2nd, I'd walk across a bridge, and I'd be in the emergency room. And so I could manage whatever was the emergency, maybe a drunk driver, or maybe it was assault, whatever, or maybe it was someone who knew that they had some type of systemic disorder, and now there's a manifestation in the mouth. So, it was anything, a laceration. It was just always going. I loved it. I loved it. It was fun,
So
to say the least.
Once you finish that degree,
Yes.
and you've got your certificate,
Yes.
where did you go from there? Did you go into your own practice, or did you work in hospitals?
No, actually, my father's tennis partner is an oral and maxillofacial surgeon. And so we kind of knew Dr. Scott's lifestyle. We knew his office. I had my teeth removed at his practice. So I said, I would like to work with Dr. Scott. And he took me right under his wing. At that point, I had 6 years of oral surgery. And I was his associate. He showed me the business aspect, insurance, billing, marketing. How do you have the right accountant? How do you make sure you take care of taxes? I mean, every nuance of how to be an entrepreneur was my first step, 2011. And Dr. Scott, it's great to have a mentor. That's what I would tell anyone listening, any of your audience. It's important to have a mentor, someone who can show you the ropes without making you feel bad. And another thing that Dr. Scott did for me is that he showed me how good it could be, so that I could still want that hunger and that drive of being ambitious. He showed me the ropes. It was wonderful.
That was very fortunate, because a lot of dentists will go their whole careers and never have mentorship, and so they stumble through trial and error at
Yeah.
best, rather
Yeah.
than even you were gifted
Yes.
to go and work for him. But other dentists never realise that there is a path between trial and error, and that is go find yourself a mentor as well. If one's not given to you, go
Right.
find yourself one. But to have all the things that weren't explained to you in dental school, and that's exactly what you just went through: marketing, accounting,
Yes. Exactly.
insurance, billing, all the
Right.
you get a piece of paper saying you can do it, but
Right.
you're just you're doing the hardware.
Right.
You're not doing all the bits that put it together. So that was very
Exactly.
lucky. How long did you stay with Dr. Scott?
I stayed with Dr. Scott for 2 years. It was a relationship where I would have purchased his property. It was not just sweat equity, but at that point, he was ready for me to buy it. Um, he was very ready because he was also, let's just say, getting older. So he was looking for someone to turn his property over to. Maybe not completely. Maybe he wanted to work there part time, and I would have taken on more of a responsibility as an owner. Um, but what happened, David? There's a lot of things that a woman needs to consider. And I was there for 2 years, and a gentleman that I had dated in DC says to me that he wants to marry me, and he was very adamant that he would not live in Philadelphia. So I'm at a crossroads because I have built this foundation of a serious business entity and love, and romance, and should I say yes? And I said yes, David. I said yes. So Dr. Scott paid for all the party and the music and the excitement at our wedding. And with a sweetheart, he said, "I'll miss you and good luck." And so I moved back to DC in 2013, and I'm still friends with Dr. Scott, of course, and we still communicate. And we it changed. And another thing I would tell anyone is take a leap. Take a leap. Sometimes things are right there, but you turn around and you just make a new step in a different direction. I one time had a colleague who joined our practice late, and she was in that kind of crossroads, and I told her, go to Houston. Go. Just go. She thought that she had already started something. I said, nope, you're just getting started. Don't worry. You won't miss anything. So, yeah, it worked out that way.
So I just want to close off. Is Dr. Scott now retired? Has he sold his?
No,
So,
no. So that story happened with, so I probably left. I left in 2013. We got married in 2014. So I would say maybe 2018, Dr. Scott did match up. We'll call it a DSO, like it was a man who owned multiple dental um, offices. And so they became more of like a business partner. And so Dr. Scott left the office location that we had worked in for many years, but he moved into a different location. And so him and that dentist are business partners, and he's doing fine. He's more leisurely. Um, and that's what happened to Dr. Scott. He's still doing great. We see each other for our oral surgery annual meetings, and he knows I'm doing fine. He's very proud of me. He showed me the ropes, so we're okay.
oh, he's still playing tennis with your dad. He's still speaking to you.
No,
No?
he's still playing tennis, just not with my dad. He is a tennis champion. He's been all around the world playing tennis, and an tennis enthusiast. He's taught other students tennis. Yes, the only reason he's not playing tennis with my father is my father's not alive.
Oh,
But he is playing tennis. Dr. Scott is doing great.
oh, good, good. I'm glad
Yeah.
Dr. Scott's still playing tennis. So,
Yes.
so now you've moved to DC. You've got a
Yes.
husband, and
Yes.
step, Julia, in this story. Like
Yes.
we were talking
Yes.
movies beforehand. I'm thinking there's a movie plot happening here.
You're good. You're good. You're right, David. And the idea is that where we're starting now is 14 years ago. So we have some catching up to do.
Oh, we could do it
Uh,
like
I
Star Wars. We
yeah,
could start at episode 4 and come back to
yes,
1, 2, and 3.
yes. So at that point, living in DC, still being a independent contractor. So I'd work in one office here and one office there. Dr. Scott said, do never, ever work in a general dentist office. As an oral surgeon, work in an oral surgeon's office. So I tried different things. I did work in a general dentist just to see what he was talking about, but not for long. And then I found an oral surgery practice about 40 minutes outside of DC, and I stayed there for 10 years. I loved it. I even helped them get a third location. So it was wonderful. It was 2014 to 2024. Cheers to 10 years. It was great. It was good.
But
It was good.
you're not there now?
I have stepped away. Now here's why. I say it was great, but the office was called the Northern Virginia Oral Surgery Associates. It actually was owned by a DSO. So I never had that need to buy in or to somehow to put money down to become a partner. I never had to put any money out. I was only collecting money, which was good. That's very important. Um, I learned things, a way of how to invest my money and make money. Actually, David, I can talk with you about that. Um, but what it did is it also made it so that I would come in, I would do surgeries, and I would leave. I didn't really have too many responsibilities of ownership or the business aspect. So I was an employee, in, out, taking my call, seeing the rotations of the patients and, moving up slowly but surely to become a senior surgeon. Um, and then in 2025, I realized, you know what? There's more to life than this. Because I was so focused. I would take teeth out. I would do bone grafts, membranes, implants, sinus lifts, all on fours, reconstructions, third molars. It was really mechanical. I loved it, but I felt like it was slightly mechanical, and also there wasn't really a change of the routine other than different days were different procedures, maybe a biopsy here or there, taking out teeth for orthodontic treatment. And because I was an employee, I had a annual contract renewal. So 2024, after 10 years, I decided I wasn't going to renew the contract. Yeah, my husband goes, so what are you going to do? I said, I don't know yet. Let's figure it out. So that's where I'm at. It hasn't even been a year yet, David.
So have you decided what to do, or you're still making up your mind?
Yes. No, I started a school.
I thought so.
Yes, I started the International Implant Institute. I am teaching general dentists how to do surgical procedures. I realized my passion is teaching, because people used to say, hey, you're a pretty good teacher. And I'd be like, I don't know, what are you talking about? But I like to be able to help people broaden their perspectives. It's wonderful. Yeah.
And so tell me about the school. What sort of things can a general dentist come to you for? What can
Yes.
they expect to be offered in terms of choices?
Yes.
And what are they going to end up when they've finished those courses?
Yes.
What have you got?
What can they expect to be offered? They can be expected to be offered opportunities to be more productive, opportunities to be more efficient, and opportunities to enhance their surgical skills. What can they take away from the program? They can take away a certificate of completion, which is also a continuing education. So I did do all the necessary steps for accreditation. Um, And I just really want general dentists, especially those that may be coming out with major student loans or wanting to do more procedures that perhaps their host or owner or associate isn't willing to really teach them or doesn't have time to teach them. I'm learning a lot of general dentists from dental school are not taught implant placement. They're not taught uh, practically bone grafting procedures. They're at the bare minimum of understanding how to restore an implant. So I want general dentists to have more of a confidence. They should know how to do minor tori reduction. They should know how to do atraumatic extractions and suturing and membrane placement and maybe even an internal sinus lift. Just a little more than your regular bread and butter of crowns and fillings, especially in 2025. I want to broaden their perspective of what they're capable of doing.
I think you've raised a really good point here, Julia, because that is a major failing of a lot of undergraduate courses. And we spoke about the business side of dentistry not being covered in an undergraduate course, but a lot of different departmental classes, oral surgery, orthodontics, pedodontics, oral pathology, all they ever taught in a lot of cases is just how to pick up a pad and write a referral.
Right.
I don't know what this is. Can you tell me? Can you help my patient? And I know that's what my undergraduate orthodontics was like in Australia for me and for a lot of people back in the 70s and 80s, long time ago. But I'd even heard of a dental school in the US where they only ever graduated having taken out 2 teeth. The first one, the instructor pulls the tooth out and then puts it back in the socket, and then the student pulls it out. And the second one, they have the instructor holding their hand while they've got their hand on the forceps, and that's it. And that's very difficult to be in an isolated community where there's no specialists, and all of a sudden you've got major oral surgery to do just in removing teeth, and you're not prepared. So when you start talking, like, even I haven't picked up a drill for nearly 8 years. When you started talking about sinus lifts and grafting, it's it reminded me of when I used to visit my mother's house and see that wooden spoon in the kitchen drawer. That same shiver went down my spine because those were things that I just didn't want to know about in dentistry because they just sounded so difficult. Just the term sounded so difficult. No. So now you're bringing that to everyday general dentists to be able to learn. So how long are the courses that you have? Are they an annual course, 2-year course?
So my course is geared for those that just need the basics, like to know how to turn the motor on, to know how to attach the pieces together, to know the sequence of drill bits, to know how to properly analyze x-rays, panoramic x-rays, and 3D scans, to even get their mind thinking, is this a candidate? To get them on the right track of, well, if I'm going to have this tooth removed, how are we going to replace it? What's the most ideal occlusion relationship? So I really just want to kind of like turn the light bulb on first. So we have a flagship course, which is Monday through Friday, the basics, how to place implants, how to think strategy, how are you going to do the measurements between a tooth and an implant or 2 implants together. I do talk a little bit about guides. We have a multi-specialty faculty, and so the placement of implants is done by the periodontist. The how to restore the implants is taught by a prosthodontist named Dr. Yuvan Anarobi. I like to teach the dentist, okay, well, maybe you can't place an implant. Why don't you know how to graft the socket? You should know how to use particulate matter versus a collagen plug. You should know how to put a membrane there. You should know how to suture the membrane. So as an oral surgeon, I hope to get them at least exposed to why are we grafting sockets? How do we do ridge augmentation and bone preservation? So the flagship course touches on a lot of information. In addition, everyone receives CPR training, ACLS, BLS, and PALS, which I think is very important. If I'm teaching them how to do procedures that are slightly out of their comfort zone, they should be able to manage the emergencies. We don't want someone to have a syncope episode. We wouldn't want anyone not to be aware of the importance of blood pressure and how do you manage someone who has high blood pressure. So CPR training, ACLS, BLS, and PALS is very important information. And then they also get direct observation of procedures because our institute is located in an oral surgeon's office. So they're in the hustle and bustle of the oral surgery office. You'll see the patients coming in. Perhaps they'll see an immediate implant placed or see an implant placed in an edentulous space. So I believe that's one of the things that makes our program a little different. It's not like it's in a conference room in a hotel somewhere. We're in an oral surgeon's office Monday through Friday. And then one of the days we'll also go on a class trip to the dental lab so that they can see the juxtaposition of, well, what happens if you take an impression, send it to the lab, and the lab gets you a crown versus intraoral scanning, extraoral scanning, digital workflow, and now you have the crown milled or the hybrid milled. So we're trying to bring in cutting edge technologies, again, really expanding people's minds to what's out here in 2025.
Wow. All in 5 days? They get all that in 5 days?
5 days.
Wow. I like the field trip.
Yeah. And we do go to Washington, D.C., because you can't come from all over the world. We've had people come from Nigeria and Kenya, California, Alabama, Atlanta. And so we take everyone to the Capitol and the Washington Monument and the statues in DC. So, David, bear with me. That's our flagship curriculum. We have weekend courses, Friday, Saturday, Sunday, hands-on training. And I've just implemented an evening course. Actually, just this March is going to be an evening course on nitrous oxide for general dentists. So I'm really trying to get folks aware of some of the continuing education possibilities that we have available.
Julia, again, you're pointing out the deficiencies in general dental degree undergraduate courses that people are graduating. And, I remember when I bought my practice, not when I bought my practice, actually I started working in an office where a dentist had gone overseas, and I had to buy a nitrous oxide machine. But I knew you need happy gas to
Yes,
for that market, but
it helps.
I had very little undergraduate training in what to buy, what sort of machines. I bought it off a general dentist who was studying to become an orthodontist. He said, I don't need nitrous oxide for putting on brackets.
Right.
So, and that machine did me for, because it was a portable one. It did me for the whole of my career. But you're right. Other than that, in hospitals, it comes out of the wall. So that education is very, very important. I love what you're doing, and that you're also reaching out to educate people from overseas, and also you're adding that local flavour. A tour of the Washington Monument, and is it Thomas Jefferson in that?
Yes, that we can see the Thomas Jefferson. And actually, if I'm not mistaken, we see Abraham Lincoln statue as well.
That's the one I was thinking, Abraham Lincoln, yeah. A lot of people wouldn't have even seen that pond of remembrance except in Forrest Gump. That was
That's
it.
Right. That's right.
And
That's right. That's right.
I tell you what, I don't know if you've got time to incorporate it into your course, but what impacted a lot for me was the night tour of Arlington. And seeing the statues of the Vietnam memorial there that are lit up at night.
Absolutely.
A lot of people have seen it a lot of people that I did that had said they'd never seen it at night. They'd only seen it during the
Absolutely.
day, and it was quite emotional for them because also
Abs-
being a more recent war as well, they
Right.
knew people who had been to Vietnam. So anyway,
Yes, yes, yes. That's a good idea, David. I'll do that. I'll certainly get the next course is April 7 through 11. And we have quite a few people who've registered. We try to take between 6 to 8 students. I'm willing to take 10. But adding an additional tour is not that tricky. It could happen the evening that we go to DC since we're in the area. And then we all take a shuttle to get back to the hotels because we give the students hotel recommendations that are not too far from the Institute. I could do that.
there you
I'm open.
go.
Yeah,
There you
I'm
go.
open.
Um,
Absolutely.
so so the institute is only in its infancy. It's only just started, and yet it sounds like
Yes,
it's going really well, and it's got you
yes,
excited. And it's an
yes.
example of what did you say there before? In terms of the push you gave to that friend who went to Houston, it's just you take a leap.
Oh,
Um,
yes, it certainly has been a leap of faith. It really has. I told my brother the other day, we used to, when we were kids, you seem to like movies, David. There was a movie called Indiana Jones,
oh yeah,
and one of those, and Indy is standing on some side of some massive crevice, and it's a hole in the ground. It's a deep, dark cavern, and you can see the other side that he's supposed to get to. And he puts in his hand some dirt, some dust, and he kind of throws it across and the path illuminates, and you think to yourself, oh, you just have to take a faith. You if you don't know that that path is there, you just throw a little dirt out there and you'll see how it's almost like the steps for the stones just come right in front of you. Each step comes naturally almost. I love it.
well, I think Julia, it's a case, and you seem to have that mindset, that belief that um, the the initiation of the process will
Yes,
reveal what the process has to be. And a lot of
yes,
people don't ever take that first step. They don't have the trust that, could you imagine what the world would have been like if Christopher Columbus had not decided to sail off the edge of the world? He sailed to America thinking that the earth was flat. He was looking for the end of the world.
right,
And the navigation of the globe by Magellan and
right,
then Cook opened up whole new lands. Um,
right,
if
right.
if they had believed what everybody else had believed, um, then they would never have sailed. So I guess you're a visionary, and talking about movies, it's a line I often use with my clients from The Empire Strikes Back, where Luke is learning from Yoda, and and Yoda just tells him, Luke, you need to trust the Force. Luke can't
Yes.
see it. He's got to trust the Force,
Mhm.
and very 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 important. I did have a I did lose faith in movies when I was hiring. Um, Back in the day, hiring videos from a Blockbuster video store,
Oh,
and I was hiring Mississippi Burning, and the guy at the
okay.
store said this is a very powerful movie. He said it was so impactful that when it came out, they decided to reopen the case. Well, the movie was totally fictitious. There was
Oh,
it wasn't about a specific case at all. So
oh,
that movie actually had inspired this guy to tell me a lie to make me hire the movie. But
oh.
so we've got to be kind of careful that what we see in movies is not
Yes.
100% factual sometimes.
Right. It's a figment of your imagination.
A
Right.
figment, a
Right.
figment of a director's imagination as well. But
Yes.
if it inspires us to be better, then that's a
Yes.
good thing, and that's the important thing. And so what you've told um, me and the viewers here today is a journey of somebody going from school and wanting to be a doctor and then wanting to be a dentist and then working out in dentistry that you wanted to be an oral surgeon,
Right.
um, that again, making it up along the way is really, really important. But and even meeting Dr. Scott and
Yes.
him inspiring you and falling into that position where he explained to you how to run a practice straight away. It's education, purposeful education on the run. And
Yes.
I
On
think
the run.
what you like you mentioned that you were talking to your brother about the Indiana Jones scene,
Yes.
but
Yes.
is that explaining to your brother about how your life has been or how your life is now? Or
It was to explain taking a leap of faith
mm,
because it's my younger brother, and um, he has been a especially guarded individual. He's a very uh, he likes to go by the rules. He likes to have methodical planning. He likes to do things strategically, and I might be slightly not like any of those things. And so I say to him, come on, you need to take a chance here and there. It's a leap of faith. It's not, you may not have already figured out the ending. You have to do some jumping out there to get things started. So it's just big sister love. That's all. Take a jump.
yeah, it's I think if we look at our families, there are some members of our family who are risk takers. I certainly
Yeah,
was in terms of, um, you know, just knocking on doors to get loans and
right,
and setting up a business with hardly any capital. Other
right,
people in my family wouldn't wouldn't take those risks at all.
right.
Yeah, and somewhere in between. It's quite bizarre why some people end up one way and others end up another way.
I don't know, David. You're right. But see, also at the same time, that's what makes life so interesting because sometimes you can match up with someone who may not be as much of a risk taker, and so together you guys make progress and be successful. So as the more of a risk taker sister, I want to match up with my brother and move him along. So that's the best part. And Dr. Scott matching up with me and showing me what life has to offer. So I love the variety of life. I'm taking another risk, David. Let's see what you think. One of the courses that we have coming up is we're taking the students to Cancun so that we can do live surgery procedures. So I didn't want to just have people going to another country, putting in implants, and not having the follow up of continuous care. So I visited the clinic in October. I saw the lay of the land. I understand the closest hotel so that this is not a spring break fun trip. This is surgery. And so I got a hotel that's within close distance to the surgical center. I saw how the surgical center is set up. They have cutting edge technology, including CT scans, and we can do some guided surgery if necessary. And I see that maybe Spanish is an issue. So the restorative dentist is going to be the assistance for the students so that they can speak the same language and also so that we can talk together. Okay, well, this is the ideal surgical placement, but is this the ideal restoration relationship? So we're going to have good conversation there. And I communicated with the specialist that's there, so I feel like he's a decent person and has a same mentality that we want to have good care for the patients. And so we're going to have a trip in May. It'll be May 15, 16, but we arrive on the 14th. So it's 14, 15, 16, 17. And I can't wait. We're going to do a lot of surgery and whatever the patients need. And it's important that some of the students, well, that all of the students have had pre-training. So that would not be an introductory course. That would be one for someone who's taken several continuing education programs or maybe placed implants in private practice and needs some more guidance. Um, we could be doing some all on four cases. So that would be a little more advanced procedures. I think we can handle it. I just need to see the folks start to register so I can get a feel of who the students will be.
Wow, that's exciting. Now, are any of my colleagues in Australia able to come and do your courses?
Oh, yes, of course, of course. I would love for your colleagues in Australia to attend.
Because this podcast
Absolutely.
does go globally, so
Yeah.
I just wanted to. I do have a
Yes.
strong Australian audience, but I do have a
Yes.
strong North American audience and English audience
Absolutely.
as well. So
Absolutely.
that'll be
All are invited. All are invited. They can find us. I have a nifty website. It's called extractionjackson.com. You can find me. That leads to it. But also, you can find us at International Implant Institute, which is INTLIMPLANTINSTITUTE.com. International Implant Institute. So
I've got.
sometimes Extraction Jackson's a little easier to remember.
Yes, sometimes that is, and so they can just get in contact with you directly
Yeah.
there. You're also
Mhm.
on LinkedIn.
I'm on LinkedIn. The website will show them more information. It'll show them the payment portal. It'll show them a day-to-day of what to expect for the curriculum, for the flagship program, for the course in Mexico, and also our upcoming course called Breathe Easy, which is the nitrous course in March. Um, I'm also considering a additional course because I would like to team up with a hygienist. I have one in mind because I think it's important that general dentists understand the maintenance protocols for implants. We're placing them, you're restoring them. Let's know how to clean them. They're not teeth. We're not using brushes. We want to be sure that you're using appropriate techniques to reduce the biofilm and make sure that implant health is maintained. So, hygiene course coming up soon.
All right, that sounds exciting.
Mm-hmm.
I might be able to recommend a hygienist for you if you're.
Yes, please.
Yeah, all right. I'll email you that for sure.
Absolutely.
All right.
Yes. Yeah.
Well, Julia, it's been great chatting with you. Exciting as always. I think
Thank you.
we covered a lot of interesting topics before we came
Thank you.
on air. But
Yes.
I'm looking forward to the next chapter. And as we were talking movies before we came on air, I'm looking forward to the movie of your life because
Oh my.
it's been quite the journey so far. And I'm looking forward to the sequel because
It's,
where you're at now, I can see this could go in a number of different directions, all with great success for you. So, Julia,
thank
thanks for being a guest on the Ultimate
thank
Dental
you.
Podcast,
Thank
and
you.
it's been great talking with you. Thanks so much.
Thank you. And Ultimate Dental Podcast. This has been terrific. Thank you.
Thanks, Julia.
All right.
Thank you for tuning in to another inspiring episode of the Ultimate Dental Podcast. We appreciate each and every one of you for being a part of our dental community and joining us each week on this incredible journey. If you found value in today's episode and you don't want to miss out on future episodes packed with expert insights and actionable strategies, here's how you can stay connected with us. Firstly, hit that subscribe button. Whether you're listening on your favorite podcast platform or watching on our website, subscribing ensures you'll never miss an episode. Secondly, share the love. If you know a fellow dentist or colleague who could benefit from the wisdom and knowledge that we share here, please share our podcast with them. Also, please share the podcast on your socials by simply clicking on the social icons wherever you view or listen to this podcast. Together, we can all do our bit to elevate the dental profession. And finally, stay engaged with us. We love hearing from you. Your questions, comments, and feedback fuel our mission to provide the best content for your professional growth, your personal growth, and for your practice growth. Remember, your journey to creating a dental practice and a business life that you love is our mission, and we're excited to be your trusted guide along the way. Thank you for being a part of the Ultimate Dental Podcast. Until next time, keep smiling, keep striving, and keep on tuning in to the Ultimate Dental Podcast.